Good morning, everyone. I am so grateful that you joined us today. And we are here as part of something really special, Forum for the Future, which is a coalition of coalition and individual members dedicated to building a state of the art early childhood system in Mississippi. So, whether you're representing families, health systems, early care, advocacy, research, or community groups, you belong here. Together, we're building something bold, something urgent, and something lasting for Mississippi's youngest children and their families. Next slide, Mindy. All right, so I'm going to give you our agenda for today. I just gave you the welcome. And in a few seconds, I'm going to review with you all Forum for the Future, our coalition, and we're going to talk about the common agenda that we have been working on for the past year and a half, it seems. And then I'm going to turn the floor over for our presenter today with Dr. Nakeitra Burse. She is the Executive Director of Six Dimensions. And we're going to continue on. So, who are we? Forum for the Future, and I mentioned this earlier, it is a Forum for the Future, is a coalition and individual members. It brings together people and organizations across the state and even nationally to center the needs of infants, toddlers, and families. And today we are currently 321 members and growing. Next slide. All right, so this is how we operate. Our approach is rooted in collective impact. That means we aren't just talking, we're working, aligning our efforts, and making space for new voices. We commit to some bold operating norms, which you see on the screen, which includes owning the work, trusting the process, dismantling inequities and overcoming mistrust, leaning into discomfort and each other, choosing learning over perfection, and persisting even when the work is hard or incomplete. This isn't performative, these are real guiding commitments for how we collaborate. At every meeting and milestone, we come back to our core principles, and you'll hear them often. Show up fully, that this work belongs to all of us. Be open to discomfort, which as we've been going through lately. Growth happens here. Prioritize learning. Mistakes are okay. Relationships matter more. And stay the course. We're in this for the long haul. Next slide. So this is our timeline that you will see here, and this is where we are in this is where we have been since May of 2024, and where we are now well into October. And so in October, we're going to celebrate together at our State of Baby Symposium the work that we put forth to get to these priorities that you will hear in just a second. And so just take a glance at our timeline and how much work that our steering committee members have put in place, as well as our coalition when they voted for the priorities that you will soon see. Next slide. All right, so like I mentioned before, we are building a state-of-the-art early childhood system. And so our goal is by 2030, Mississippi's early childhood system will be state-of-the-art, fueled by robust data, resources, and cross-sector collaboration to meet the needs of all children and families. And within our circle here, you see where it holds state-of-the-art early care and education, healthy mothers and children, and strong families. And the overarching is a coordinated, efficient system. And I'm going to break that down for you all with the next slide, starting with our next slide. In the state of the art, early care and education. Go back. Go back. Okay, there you go. Thank you. So within our state of the art early care in education, our four priorities there are: the system is supported by sustained resources and investment, improves health and academic outcomes, increased access to affordable childcare, and childcare is a stable, competitive, and respected field. Next slide. Our newest priority category is strong families. And within strong families, we want a responsive, family driven system of care for young children, equitable access to paid family and medical leave, child welfare practices work for babies, and families are economically secure. And the next slide gives us a brief detail or some examples of what we were thinking about when our steering committee discussed these priorities. So this just lets you know of some examples that will fit those priorities. So those are the four for strong families. All right, our next slide, healthy mothers and children, our next priority. And these is access to a comprehensive, high quality health care from conception, access and affordable health and nutritious food. Young children live in healthy, safe environments, a supported, compensated, and qualified healthcare workforce, timely, high quality, and responsive mental health care, and timely, high quality, and responsive access to early intervention services. And again, these are examples that you will see that fall within those priorities. And that's the first three, and our second three are there. All right, next slide, Mindy. All right, and then we also want to have a coordinated, efficient system. And it says Mississippi has a functional, family friendly early childhood system supported by an efficient and coordinated infrastructure for children and families at both the state and local levels. And our steering committee took a lot of time in developing this definition for this coordinated efficient system. And so we are very, we think that it holds true to what we would like to see about the system. All right. So, as you all have heard about Mississippi Forum for the Future, and you are not a member, if you're not a part of that 321, we would love for you to be a part. Our website has changed, and Mindy has put it in the chat, but it's mississippifuture.org. If you would like to become a member or learn more about Forum for the Future, please go to our website. And Mindy, would you like to share more about the updates that you've done to the website and what they can find there?
We are so excited. The website has gone under a pretty drastic overhaul over the last year. We've included these new priorities as a drafted priority that will change to full priority after the launch next week. And we've included areas like the steering committee. We have a shared calendar on our website where there'll be when you click on it, you'll see all early childhood, not just early care and education. There'll be additional pillars as well, events and meetings that are taking place across the state. We're updating it frequently. You can submit your events there as well. We are really excited to launch the Forum for the Future Facebook, Instagram, and YouTube channels. You can follow us and be a part of the conversation there as well. So give those a look, please. Thank you.
Thank you. And all that we ask in return for your membership is that you share opportunities with your networks, follow and engage with us on social media, and join us for our newsletters and our meetings. And just, we'd love to have you on board. All right, we are gearing up. Next slide, Mindy. We are next week is our State of Babies. It's going to be October the 22nd at the Eagle Ridge Conference Center in Raymond, Mississippi. And the State of Babies is Mississippi's Forum for the Future's annual policy and advocacy event dedicated to ensuring every baby in our state has what they need to thrive. And so on October the 22nd, we have leaders, advocates, and community members from across Mississippi, and we're going to gather to reflect on progress, align around key priorities, and we're going to chart a bold course for the year ahead. And this year's event, we're excited that we're going to have some media engaged to help us tell our stories and to make sure that our voices are heard. And so if you have not registered for State of Babies and would like to attend, you can drop your name in the chat and we will send you information to register. But as we have been preparing for State of Babies, and the reason why we have Dr. Burse here today is because we wanted to, if you're not able to attend State of Babies, we know that there are key issues that are going on and we want everyone to be aware. And so one of the things that she's going to talk about with us today is one, it falls within our draft priorities. And so I am now going to turn it over to Dr. Nakeitra Burse. The floor is yours. And we look forward to hearing what you have to tell us today.
Good morning, everyone. Glad to be here. I'm gonna, let's see, share my screen, make sure I share the right one. Okay, and you all can see my screen well. Okay,
Yes, we
so
can see you.
I'm gonna talk today about why eliminating the diaper tax in Mississippi matters for maternal and infant health. And I'll kind of talk about the process for how we came to advocating for this issue as well. And so, just a little bit about us. We are a woman led Mississippi based nonprofit organization. Our sole focus is improving maternal health outcomes, and we do have a specific focus for Black mothers. And so here's our team. We are a very, very small team. We rely on not just the team that you see here, but also consultants and contractors who help us move our mission forward. And there's our marketing team as well. And I think it's important I always take the time to recognize my team in every setting because they are committed to maternal health. That is one important part of all this. They are specifically committed to this work. And I think that's very, very important. And also, they are all like, I have already just acknowledged that I'm getting older because every week that we meet, they let me know that I'm moving on up there. They are much younger than me, and I think that's a good thing to have them around. And so our mission is to enhance Black maternal health outcomes through research, training, outreach, and advocacy. And the core of our work is honoring history, respecting culture, and amplifying the voices of the communities that we strive to support change for. And so, as I mentioned, we do research, training, and development, as well as outreach and advocacy. And just a little bit of background on the issue of maternal health in Mississippi. And there is a new maternal mortality report that should be coming out hopefully in the next month or so to give new data on the state. But from 2016 to 2020, the rate for Black women in Mississippi was 63.3 deaths per 100,000 live births. And that was more than 4 times the rate for white women. We have been seeing a significant increase in deaths among Black mothers, while there has also been a decrease in deaths among white mothers. And so I think a part of that is also we're looking at more of those determinants of health and environments. I do sit on our maternal mortality review committee, and we are charged with looking at if there was discrimination, if there was homicide, if it was mental health issues. So we look at a range of issues that impact those mothers' outcomes. And we also look at that from the perspective of pregnancy associated versus pregnancy related. And so pregnancy related is mom may have died from something that was specifically contributed to that health out, well, her health. So maybe like preeclampsia or heart disease, something like that. While pregnancy associated may be something, some other factor that contributed to her death. And so some of that we may look at is homicide. We have had a significant number of those deaths in our state as well. And so I think we will start to see the landscape shift a little bit when it comes to maternal mortality in the state and what that looks like and how we address it. And so we know that we can't keep doing the same thing. We have quite a few, there are a lot of organizations working on this issue, and I'm just excited to see what we can come up with moving forward so that we can really have some change. And so regarding diaper need, specifically what I came here to talk about today. This is just some national information from the National Diaper Bank Network. And they, in 2024, they did a survey of families around diaper need. And so among families with diaper needs, 60% were low income, 30% were middle income, and 10% were high income. So that shows that this issue really cuts across all income levels, but also that diaper need intersects with food security. And so 27% of those families that responded reported that diaper need, well, those that reported diaper need said that they did skip meals to afford more diapers. So that tells you how serious this issue is. And also there has been a sharp increase in diaper need. So 46% of those families responded and reported diaper need in 2024, and that's up from 33% in their previous survey in 2010. And this just shows that parents are being forced to ration diapers, exposing babies to severe illnesses and issues. And so we know that diaper need places an unnecessary financial burden on families. When we have a diaper tax, it's we kind of think of this, and our friend Shalisa Presley says that diaper tax is a need. It's not, or diapers are a need and not a luxury. And the National Diaper Bank Network states that Mississippi and Tennessee have some of the highest sales tax on on diapers, and well, our sales tax period is at 7%. Other states may be around 4%, but Mississippi and Tennessee have the highest sales tax. And then children require at least 50 diaper changes per week, or 200 diaper changes per month. And my children, I'm like, okay, that kind of seems low to me. But we change diapers back to back all day, and just thinking about the need for diapers, it puts a strain on you if you anyone, not just those that have financial need, but everyone. My father is an alderman in North Mississippi, and he's really starting to get into these issues. And he told me one day, just randomly, he said, I did not know that diaper need was a big issue like this. And so I think it's important that we continue to talk about these issues in a way that resonates with folks who may not be on the ground like us, who are doing this work specifically, but those who have the ability to make changes in their community, whether that's a local municipality or across the state. And then a few years ago, as we were experiencing the overturning of Roe versus Wade, we saw that anticipation of an increased number of unwanted pregnancies in the state. And so if that turns to be true, then there's still a significant need for diapers in our state. And for Mississippi families, they spend about $80 to $100 per month. And I'll say I'm sorry, because I've been in the diaper, I've been in the diaper trenches. Thankfully, I'm out of them. But adding sales tax increases this burden up to $7 per month. And of course, we know that federal programs like SNAP and WIC do not cover diapers. And then the fact that it impacts health. And so those severe diaper rashes for not being able to change as needed, and then infections and possibly hospital visits. But what we also look at is that impact on employment, because if we don't have adequate diapers, you can't send your child to daycare, and then you have to miss work. And that's a big, big issue in our state. And, we talk about productivity and how to get mothers back to work in a space, but making sure that they have adequate diapers is critically important. So I just want to talk for a few minutes about what other states have done. So some states have invested in diaper banks, which is meaning that they added them as a line item in their budget, or through some action of a state agency, or even bypassing the legislation, saying that the state will provide funding to the diaper bank. There are several states that show that. Tennessee is one of those states. I'm trying to look for the southern states. Tennessee and Georgia. So Tennessee had $1 million for diaper distribution through their Nashville Diaper Connection. And we know that Nashville is a pretty big metropolitan area, so that probably doesn't even cover many of the rural areas of their states. But also Georgia allocated 1.22 million in TANF funds in 2021 and 2022. There are no updates currently for the Georgia numbers. And then also providing direct assistance to families. And so states can make diapers more affordable and available to families in need by directing or by providing direct assistance to families. And that's like in the form of a voucher, or an additional allowance of families as a part of a work support program. We hear a lot about, working when it comes to Medicaid, but this is what other states have done. Currently, California and the Washington state provide that type of assistance to families. And then TANF caps, which has helped. Of course, we know that TANF funds are used to support families, low-income families, but some states receive block grants to design and operate programs that accomplish one of those pieces regarding diaper need. And then also Medicaid coverage. Some states provide Medicaid coverage to diapers to individuals who qualify for medical conditions and who are beyond the age of typical diapering years. So that's your children or families who may be experiencing other health issues above just the normal diaper situation as, toddlers. And so then tax credits and deductible deductions, states can support diaper banks in their work to end diaper need by implementing tax credits and tax deductions. And so these are just a few examples of what other states have done outside of legislation specifically. And so, how we came to advocating for this issue a few years ago, we started working with a group of maternal health advocates around the state that run organizations or are part of organizations. And so we tried to outline what were some of the most pressing needs for maternal health and what does a policy look like for those. And so we came up with these key areas, which are access to quality care and expanding the maternal care team, supporting mothers in the workplace, ensuring accountability for systems of care, alleviating the economic burden on Black women, transforming data, maternal mental health, and environmental and reproductive justice. And so, of course, we know access to quality care looks like Medicaid expansion. Expanding the maternal care team for us looks like uh, doulas, birth workers, midwives being a part of recognized as a part of the maternal care team, and ensuring accountability. Well, supporting mothers in the workplace is more about like having systems in place, whether that's policies or practices in place where mothers can express their breast milk, paid family leave, and those things that support families in the workplace. And environmental and reproductive justice have come up quite a bit here recently. Specifically, we have data centers coming to our state. Some of the emergencies that we've experienced have not specifically focused on families. And so those are some of the big issues that our group kind of looked for. And then the next thing that we did was kind of narrow that down. So, what are things that we can actually achieve with this group of folks who is committed? And so alleviating the economic burden on Black women was one of the bigger issues that we pulled out that we felt like we could make some changes with. And that's where the diaper need came in. And so we have worked very closely with Shalisa Presley with the Diaper Bank of the Delta, and it serves on the National Diaper Bank Network. And so we have worked with them, but also we've tried to identify those potential pathways by looking at what other states have done and also reviewing the previous bills that our state has looked at as well. And so in 2025, there were four bills that focused on diaper needs. So we had House Bill 1657, which looked at children's diapers only, and then House Bill 710, which looked at children and adult diapers, and then House Bill 1519, which was a little more comprehensive. It had children's diapers, diaper bags, formula, rash cream, baby powder, and baby wipes. So a really comprehensive bill. And then Senate Bill 2047, which also included feminine hygiene products, which was even more expansive. And so none of those bills, of course, we know passed, but that was a little bit of leverage to kind of move forward in the future. And so we also pulled out some other notable bills from our previous sessions. And so, of course, in 2025, the state income tax really did take up a lot of the information, well, a lot of the space regarding bills this year, but the grocery tax was also added in there. And sometime we have talked to quite a few of our advocacy organizations around how do we align a diaper tax elimination with the grocery tax reduction to just try to see what things could look like. But in previous years, there have been bills like Senate Bill 27, '09 that looked to try to, was more of the period tax, trying to take off the tax for feminine hygiene products, contraceptive products, but it also included baby formula and diapers. And then House Bill 1264, which authorized school districts to provide free feminine hygiene products. And that is happening right now in more of the school districts across the state. And so just looking at what our state looks like and how folks are addressing the diaper need, the Diaper Bank of the Delta, whom I've referenced several times in this discussion, is located in Clarksdale, Mississippi. And so we know that's much further north than we are here in Jackson. But she's actually the only nationally recognized diaper bank in the state. And so part of her work is not just disseminating diapers in her community, but also disseminating them to other organizations in the state who then distribute diapers. And so Magnolia Medical Foundation, which is the main office is located here in Jackson, but they also distribute diapers in Natchez and on the Gulf Coast. And the Institute for Minority Health serves Jackson as well as the Mississippi Delta. And so you see, and there may be other organizations that I have left off, but that's not, on purpose. That's because these are the organizations that we've worked with specifically and that we know are receiving diapers and distributing diapers pretty frequently. And so this does not cover the range of our state. And our office is actually housed at Magnolia Medical Foundation. And there are days when Dr. Thompson, the executive director there, has to walk across the street to the Dollar General to buy diapers to refill the pantry. And so that's how great the need is in Mississippi and how folks are all lining up at the doors in to receive diapers. And, this is not one specific demographic, and it impacts everyone across the state. And so we do have the ability to change this. As of July 11th of this year, 23 states still currently charge sales tax on diapers. But by ending this, families can buy 2 additional diapers for every percentage point reduction in the sales tax for the same money they would have used to buy 200 diapers. And so that came specifically from the National Diaper Bank Network. And that just shows how we can change, what we can change, and what we need to do to really move this forward. And I believe that Mississippi is a state, we do have a lot of challenges when it comes to maternal and child health, but this is something that cuts across, like I said, every demographic, every even gender. It cuts across everyone because our families are impacted. And so I believe we have the ability to really make this change in an incremental change that hopefully leads to larger changes. And so this is just a picture from the work that we did back at the Capitol and earlier this year. And we are excited to continue to move the work forward, and hopefully we get some more advocates on board as we try to move the needle forward on diaper need. And I like to always end these discussions by saying, kind of on a high note, Fannie Lou Hamer said, "Nobody's free until everybody's free." And Shirley Chisholm said, "You don't make progress by standing on the sidelines, whimpering and complaining. You make progress by implementing ideas." And the last picture that I have here is, I don't know if everybody's seen Cool Runnings, but to me, this picture depicts that we don't always have everything that we need, but as long as we work together and each of us does our part in this bigger picture, then we can make change. So we're doing the work, all of us here as a part of the coalition, we're doing the work. And if each of us can just bite off a little bit, then we can make great change. And that is all that I have. If I'll stop sharing and entertain any questions if there are any.
Thank you so much for all of the wonderful information. And the floor is open for questions, everyone. I know we have some people in here that have some, hopefully. Comments?
Ooh, I have a question.
Okay, go ahead, Biz.
Um, Dr. Burse, there were so many different bills last year, and you mentioned sort of talking about like the history of those bills. Do have you talked to those previous champions to see about getting, which, well, first of all, what is your preference of a bill? I think like you mentioned the one that was more comprehensive. I think that included like, you know, wipes and included more stuff. So one, what is your preference? I think if like you had to choose, like what would a great bill look like? And two, I think who are you, who do you think will be championing this in the coming session?
So if I had my preference, that means in a perfect world, it
Everything.
would be very comprehensive. To me, it would be very comprehensive, including, inclusive of all the baby items as well as period products, because those two things cross over. You give birth, you got to have diapers and you got to have period products um, for your postpartum period and beyond. And so that's still, those items are not also not a luxury. They should be just a standard part of our care. um, what do I think has the ability to move forward? I don't know yet. I don't have that answer. But who are the champions? That's where we are still kind of looking. Like I said, it looks like from the bills last year, there was folks on both sides that championed this. But also one thing that we've looked at is the makeup of our legislature, which is mostly men, and how do we get them on board to champion this issue as a family issue, because they got to go buy diapers too. They got to change diapers too. It's not just an issue for mothers, it's a family issue.
Thanks. How could this coalition help you? I mean, I think this is something that, I mean, it just makes so much sense, right? Like if we're thinking about economic security, if we're thinking about child health, if we're thinking about, um, just mental health, right? I can imagine like not being able to provide diapers for my child and like
Mm-hmm.
the and also it's a
Yeah.
cost for childcare providers as well, right? Like in a lot of cases, childcare providers are providing the diapers. So then it also benefits the childcare system. So this issue, like you said, cuts across all of our coalition issues. So how can this coalition help make this a reality?
Yeah, so and as I mentioned, we are working very closely with the Diaper Bank of the Delta, because she's been doing this longer than we have. So we are definitely leaning on her expertise. But one of the biggest things that, and we had a discussion yesterday, is what does the conversation look like? And so we're right now working to frame what that looks like, to frame what our communications are. And as soon as we get those communication pieces outlined, then we want to send it out to the coalition, because I know you have child care providers that would likely get on board, families. And so we would like to be able to disseminate some of that communications widely. One thing that we did notice too earlier this year in our research is that we went back and pulled all the media around these things, and they're very low attention when it came to media and outreach. Back in, I think, the 2021 bill that was around period tax got a little bit of media traction. And I think that was also connected to the one of the Women's Foundation and Black Women's Roundtables programs. And so there has not been a lot of discussion and media attention. The other thing is that I say this all the time. We're advocating for these issues, but how often do we bring in the folks that are really, really impacted by diaper need? Many of us are, but like I said, that's long gone for me. And I have not had to buy diapers unless it's for a baby shower in 7 years. So making sure that we get the voices of those impacted and make them a part of this, because if not, we're advocating for stuff that sometimes, we know what we need, but we
We just don't
might
know
not
how.
really know, yeah, what to do
Mm-hmm.
until we're brought into the fold. And so we are trying to do some story capturing as well around this to support building the argument. And so if there are stories, even from organizations like childcare organizations, about how maybe they have to supplement diapers when a family does not have enough. That's an important discussion as well that we would love support on.
And that falls right in line. Like we had a team meeting this morning preparing for State of Babies, and I feel like you were the fifth person on that call today when it talks about media, because we will be having media journalists at our meeting to talk about how do we get them to tell the stories that are important to the work that we're doing, and also stories, wanting to capture those stories because we know that sometimes those are the things that would grasp someone's attention. So I think we are on the right track in making progress and getting our voices of the voices that whom we're working with served.
I would like to just add, as you're thinking about storytelling, Dr. Burse, see how the business voice can fit into that conversation.
Mm-hmm.
Yep. Thank you so much. That is absolutely true. And I think that has several angles too, especially if we look at families, I mean, or missed work because of diaper need.
Right, right.
Yeah, when you mentioned that workforce, I mean, and I've been in childcare centers, and I've seen parents bring in diapers for their babies, but it didn't dawn on me until today. I was like, parents are probably missing work or are missing work because they can't bring diapers so the children can be in the infant room or the toddler room all day
Yeah,
while they
or
are
a
at
diaper
work.
rash. You got to sit
Yeah.
down with that baby for a diaper rash, and then
Mm-hmm.
irritated. You're irritated. Everybody's irritated.
Everybody irritated. And we appreciate you all. Does anyone else have any comments or would like to say anything? All right. Well, I want to thank you again, Dr. Burse, for providing us with your expertise and bringing this information to us today. And we will be looking forward to hearing from you soon throughout the session. Let us know when you're all having your capital day.
I
We would
sure
love
will.
to. I would love to attend again.
Woo.
And if you do shades of brown, I'm ready.
It's gonna be shades of brown.
Okay, well, I'll be ready in my shade of brown. And we appreciate you so much. And again, thank you all. And thank you all for joining us today. And if you have any questions for us, our information is in the chat. And Dr. Burrs posted her information if you have anything for her as well. But we thank you all for joining us, and we hope you have a good rest of your day.